Nationwide, this is a problem that all of law enforcement is facing, and that is the spike in the number of people in a mental health crisis.
A huge percent of people who land in jail are in fact suffering from mental health or addiction issues. The history is that people with those issues get, somebody calls the police on them and they get dragged into the emergency room or to jail.
There were times when 3-4 different entities are dealing with the same person, but because of silos and because of some statutory requirements and because of HIPAA, we weren't able to share the information. And to me, that's not only inefficient, but it's ineffective.
We were noticing, each of us individually, that we weren't necessarily making the biggest impact that we possibly can. And as we began to talk and collaborate, that was really the starting point of saying, why can't we do things differently?
Let's not think how we always used to think. Let's think in this new world, what if?
We did what we do best here in St. Cloud. We sat down and we got all of the stakeholders at the same table at the same time. Essentially, we've torn down those silos.
So the Community Action Team is a group of people from different organizations who come together to try and give better care across services. It's identifying individuals for whom the police have a lot of calls. They get a lot of runs, or they've been incarcerated a lot of times, or they've been in our ER a lot of times. So it's trying to take those folks who are actively utilizing a lot of different services and saying, hey, this might be people that we should be, a person we should be saying, how can we do this better for this person? Because they're clearly going in and out of a lot of places. Now they do need to consent to the fact that they're part of this. They do have to agree to it. And that's a good thing. It's not forced on them, but it's an opportunity to say, hey, we think we can do this better for you together.
It literally took all of our institutions to this, each partner putting something on the table and believing in the outcome. We are so excited about these early results. We have found a dramatic reduction in the number of law enforcement calls or visits, the number of emergency department visits per person. The number of detox visits per person has also reduced substantially. And so what we're driving towards is having people use those deep end services when they're actually needed and when that level of service is required. If it's not required, much better for the person as well as taxpayer dollars to serve them in the community or in a different way.
The top 5 high utilizers in 2017 before this intervention collectively had 96 ER visits. Post-intervention, they collectively had 32. That's a huge drop. And along with that, they all had fewer incarcerations. Like some went down to 0. And they had fewer police runs. So the change is dramatic.
Many of those early cases that we tracked, and we continue to track this, the amount of savings is in the tens of thousands per person.
Some of those people have been able to integrate back into our community and find and maintain full-time employment and housing. And to me, that's what warms my heart, right? There's no greater sign of success, right, than helping somebody help themselves.
Truly, this has been a collaboration at all levels with law enforcement and human services and Stearns County Sheriff's Department and the Central Minnesota Mental Health Center. It has been a true public-private partnership, and that is the only way to make a difference in the community.
We're dreaming big here, and I want to see this get some traction, not only in our state house, but in all 50 state houses. I want them to throw their considerable weight behind this initiative or anyone that's similar to it so that it becomes a common way of how we handle this particular issue.
Other people will say, we cannot do this in our community. We're way too different, or we're too small, or we're too big. We don't have enough resources. We can't switch our resources, or our health systems are too big, or whatever it is. We hear a lot of those excuses about why that can happen. And one thing that I know is one of the best predictors of good outcomes is just believing that the outcome can occur. And so once you believe that an outcome can occur, even within your own local community, you can start being much more creative and innovative with the services and the resources that you do have.
We just see this as the tip of what else we can do. That when you break down silos, you discover a lot can be done, and this community has the ability to really jump further and say, how else can we collaborate? So out of this has come other conversations of people saying, hey, what if? What if?